age
Yeah.
can you fade this out and give like, multi-step commands or just like a generalized command?
It's a great question. Obviously this is all developmental, so and based on their executive functioning skills. But I really believe in these skills so wholeheartedly that I would say the same thing for adults. I really would. If someone, meaning not for this, but
This
like
is like really elementary though, like really broken down.
okay, but I'll give you an example. Give me like an adult task, like a really hard adult task to do.
Let's say cook dinner. Not
Okay.
hard, but okay, let's say cook dinner.
Okay.
It's multi-step.
Right, exactly.
Okay. Or clean, whatever. Clear up the table. Or
Right.
something.
Okay, so fine. So
Clean the kitchen. It's even more
yeah, clean the
complicated.
kitchen. Okay, so you're telling an older kid to clean the kitchen.
That's too much. No.
Oh, okay. So
no,
yeah.
let's say like an older kid, even a 10-year-old, get ready for bed.
Get ready
Right?
for bed. Okay.
I don't think you need to break it down to all those steps for a 10-year-old.
Well, maybe you don't have to tell. Maybe you don't have to tell it to them all at one at a time, but meaning you don't have to like wait for each one to do it. But I would still say that instead of getting ready for bed, or even do your homework, or apply for college.
Okay,
Right. Meaning my point is, I'll give you an example. When I was doing my dissertation, right, my doctoral research project in school, so that was a very long, arduous task of writing a 150-page research paper, right? And they didn't really break it down for us in terms of like how to do it. They're like, pick a study, pick a topic, and like research it, right? So what I had to really do with help and peers and all that mentors is to really break it down into, okay, step one, organize, look for research, Google search stuff, like how to even do that, ProQuest. And then that made it much more manageable for me. You could say something for doing your taxes, renew your health insurance, all these type of things for yourself. No one's telling you to do it. If you have a long task that you need to do, and this is something I'll coach with adults when they're patients of mine, if they're very stressed about something. I work with college kids, so they're very stressed about a big term paper. I have this final paper I have to write, and I'll say to them, okay, what are the steps? Well, I have to get my book. Sometimes they'll say that to me, like I have to get a book from the library. I have to, write an outline. I have to, send a draft. I have to cite stuff. I'll write down a list for them, and I'll say, okay, these are all the tasks we need to do. We made a checklist. How many of these do you think you could do today? Right? Right now, right after the session, you can go to the library. They'll say I could do 1 through 4. Great. You can do 1 through 4. You can check them off. You're gonna have a good day. You're gonna treat yourself to a nice snack, something like that. That type of, task management, I think, is just more effective. Does that kind of answer your question, or you still feel like?
Well, my question really is, at what age can you start to like fade this out?
Uh-huh.
That was really like that.
Right.
That was really my question.
Yeah. Like, so you could just say something like this.
Yeah.
Okay. So then it comes down to what we call chunking in cognitive psychology, which is basically once you have a shorthand, a shortcut that the other person knows exactly what you mean. So if you have
Already taught the change.
Exactly, taught the change. You have a clean lady coming for Pesach, you want her to kosher the house, right? She already knows what it means to kosher, right? Or if you have a whole team of people, right? Then you could say we're koshering the kitchen today, and in their head, they're gonna know what you mean, right? Or if you have a team, you have a team at work, and you know what we need the progress reports or something like that. Everyone knows what it means, then it's much easier. But first, there's a good training model. First, you teach everything step by step, and then you come up with a nickname for it or a short term that everyone knows what you're talking about. So, but I basically would make sure they know what the steps are, if they know what cleaning means and what it looks like.
So taking this example,
Mhm.
Is it fair to tell a 10-year-old get ready for bed if they already know all these steps?
I would say so.
I think it is. I think it's
Okay.
a 7-year-old. But,
Yeah.
based on what you're saying.
Yeah.
I think it's also something that like on one day they can't, it's not the type of thing where on one day they can't do it, the next day they can do everything. So like setting them up, it could be helpful to have a list even in their room of these are the different things you do, over up until they're 7, you're working on each of these things individually, and then that's really setting them up for age 9, age
So then
10.
we like the easily distractible kids. Like you could have a child who knows all these things on the list, but they're so easily distracted by anything that they just can't even get from 1 to 2 because they're dancing on the way there. And so that's why this is helpful.
Right.
But if you have a kid who can follow, the list and do it themselves, then of course.
Or how stressed they are if they're not a kid like that. If they're just a young boy or girl who had a hard day at school, or they're just going through a lot in their life, this might be too demanding for them. Meaning to know the day. Meaning like on a good day, getting ready for bed, they might be more likely to do it. On a day where they feel like, and this when I work with adults who are depressed, getting dressed sometimes for them is too tough. You know, I've had patients come here in their pajamas or not showering, not clean shaven. So like getting ready, looking presentable is too daunting of a task. So then I would break it down from, okay, today I want you just to take a shower, please, or you know, or just we're gonna, you know, pick one thing. So knowing them and their, you know, how stressed they are, knowing yourself at the end of the day. Yeah.
I was gonna say, I think it's also like we can kind of think about it. It doesn't necessarily have to be one item, get ready for bed, versus 5 items of close the game, get up from the seat, change your PJs, brush your teeth, and get into bed. But it could be, you know, two sets of 2. Like, okay, go shower and brush your teeth.
That's true. Yeah.
And then, you know,
Yeah.
blah, blah, and then after that
Right.
thing has been done, it's like, okay, go put your pajamas on
Yeah.
and go get into bed. And like you can, because you're talking about like, you know, pairing more than one task so that you as the parent don't necessarily have to remember every single step that I need to walk my kid through, that you can start to chunk them
That's true. So
together
yeah.
as well if,
2 or
they're-
3
if that's something they're capable of. Like once they're in the bathroom, there are other things in the bathroom. Okay, wash your hands, you know.
And it goes back to what you were saying about not even needing to say one command to get kids to sit and listen.
Right.
So close the game, it's time for bed. How cool is that if your child then is able to go through the whole list without reminders and being able to say, wow, you know the next step, you know what you need to do
Yeah.
next, and you don't have to do
Yeah. I'm curious, what was the like the rationale you were thinking of, like why this would be, you'd rather do this or why this is better?
Okay, just in my line of
Yeah,
work,
yeah.
like what we do is we'll give a child, like, let's say we call it SB, like get ready for bed, but then we break down the whole chain and try to fade out each step. So I'm
Oh,
just
okay.
curious to know, like, from your perspective,
Right.
at what point, at what
Uh-huh.
age developmentally can we expect them
Right.
to just, you know, give the
Yeah.
child the entire, you know, command and then go from there.
Right. That's a good, okay, yeah. So right, so I think it gets down what I said before about chunking. I mean, like once
Yeah.
they learn the whole thing, then you could call it a thing. So just to review, because I feel like these skills are, you know, more natural to me at this point, and also like I've gone through this a few times. I've prepared for this lecture. So how much do people remember? Just what's something, you know, I guess you want to share that you learned from it, or just like a skill that stands on their head as like being something you want to try right away.
Well, I think single commands, not chain commands,
Yeah.
is helpful.
Yeah.
So I think that addressed one of the many prompts that were just thrown our way.
Yeah. Okay. Cool. Thanks. Anyone else have something stick out in their head, something they want to try, or something they feel like they never thought about? Yeah.
I have a question.
Sure.
Coming from a kid's perspective,
Yeah.
I would say I know I have ADHD and I probably have ODD as well.
Mm.
I know that when my parents tell me to do things, even if it is like the positive way that you said,
Yeah.
it almost makes me angry. It's like if they tell me to say something obvious, like I'll use your example, even though it doesn't necessarily apply. If
Yeah.
my mom told me, you better pee in the toilet, I'll be like, well, just because you said that, now I'm not going there.
Wow.
So I tend to like get spiteful
Mm.
in a weird way because I don't know, I'm just a brat, I guess.
Part of
So
your, yeah.
how should a parent react to that? So I can pass this
Yeah.
along to my parents because like it.
Yeah. Okay, well, that's really cool of you to say. Bring them the packet, and you know, really, you know, brave of you to share that also, and also bring a kid's perspective. So, you know, thanks for that, because we don't have any little kids here, and if we did, they wouldn't speak up, but you could speak up as someone with firsthand knowledge. So that's why I really try and emphasize that like these are not going to work 100% of the time. Sometimes parents come to something like this and they say, I tried it, didn't work. Well, I say, well, how much did it work? How much did it didn't work? So again, maybe in your situation, you would act out either way, but maybe just a little bit more likely to act out if they said, don't do this versus if they said, do. And then that's why these are like the baseline level of skills. These are like, first try these, and then these don't work, then we go to the next level, which is like how to respond when they don't listen. Or lots of times with forced choice, parents will tell me like, I said do this or do that, and they said neither, right? They didn't want to do either. So like, okay, so then we go into like, you know, consequences. But it's interesting. I guess you're saying that the language does make a difference to you. If someone said "don't do this" versus "do this," you feel like you'd be equally likely to.
I mean, if someone says to me, "Don't do this," I'm like, "Duh." But if they say, "You better do this," then I'm like, "Well, just because you said that, now I'm not going
Okay.
to."
Well, even like "you better do this" is like not the way
Yeah.
I'd probably phrase it.
Yeah.
Also, yeah,
True.
yeah. But it's interesting. I mean, we could do a study and try and see like how it works. I think the street signs is a really cool example in terms of like, just go around and pay attention to your surroundings. You'll see if you have limited space on a sign, like you want to put up a sign that says for people to clean up after their dogs, right? You get more bang for your buck this way. Like you basically verbalize less. So it's not so much for the kids always as much as for the parents.
Right.
So I'll just say that this is a toolbox, meaning you want to like kind of throw things out and mix and match. So when I'm in a pretty stressful situation, I won't just use one, but it's kind of like Batman utility belt, right? So like I may have to use this one, I may have to use that one, I may have to combo like a 1-2 punch of selective attention and force choice and positive opposites and effective commands.
I say the forced choice. I mean, in my opinion, I like that because
Yeah.
I hate making decisions.
There you go. Okay, thank you for that. That's my favorite one also. So I want, just to give like what I call the basics. If you don't mind, just for another minute or so, it'd be really helpful. It's very quick. In the back of your left folder, totally anonymous. Do not put your name on it, and then just turn it upside down afterwards. I have like just 4 questions here. How helpful was this? And then some other questions, just so we could know we're doing another thing next time. What's your name, by the way?
Alex.
Hey, Alex. Okay. Yeah.
That's why I looked up when you said Alex. I was like, who, me?
Oh, yeah, I didn't realize that. Okay. Okay, cool.
Yeah, I figured it was
yeah.
something.
And I'll point out just 2 the kind of housekeeping things is that we are going to be doing this series, a 4-part series on parenting, totally different topics. It's going to be the first Tuesday of every month. So this was the first one Tuesday in December. So the next one is going to be in January. It's going to be by somebody else and a different topic. So actually the last question of what other topic you'd like to learn more about will really help guide us in terms of, what the other session should be. And then just turn upside down, we'll collect them afterwards, we'll mix them all up. And if people are interested, we're going to have a meeting here in a few minutes. We're going to be talking about patients, so we can't hang around too long. But right across the hall, we have this really cool room called the PCIT room, Parent-Child Interaction Therapy. And that's where we coach parents to use these skills in real time, because it's much easier to learn it that way than to learn it on your own. So if you want to just kind of take a peek in there, there's a one-way mirror. It's really cool. Otherwise, we'll stop here, and I'll welcome any feedback, questions or comments. And thank you so much for